What a powerful series we are in our third part now of our new wave of chronic illness series that we're walking through this month at Learn with Lo. If you've been joining us, if this is a new platform or a new episode to you, welcome to Learn with Lo. I'm really excited to jump into our topic of the day, which is going to be centered around labs and lab testing. It's definitely going to be a continuation conversation of the last two episodes that we've built in this series. The first episode of this series, if you missed out, was really just defining and bringing this big aha moment around this new wave and new definition that we're seeing to chronic illness. I think, at least what I have seen personally in my clinic and what I know talking with a lot of other alternative providers, that they're also noticing as well too, and honestly more from a conventional medicine healthcare, what they're noticing as well is this brand new insurgence of what we used to consider chronic illness was maybe based a lot more around lifestyle related diseases, metabolic syndrome, high triglycerides, high cholesterol, type 2 diabetes, right? And a lot of these things that were very much centered around the conventional medication or the conventional medicine conversation of your weight, right? Finding ways to eat less, move more, right? And kind of putting everybody into this like metabolic syndrome box and, treating it with medications of a lot of things that are lifestyle related diseases. And what we're actually seeing though now, not saying that those metabolic diseases don't still exist, but something that appears a lot more in my clinic and my office is this new wave and this new definition of chronic illness that, let's be real, that conventional medicine model is not appropriate for and is not even close to being ready to handle and is not equipped for this new wave of chronic illness that is really revolving a lot more around chronic immune dysfunction. It falls under the umbrella of all of the autoimmune diseases and patterns, chronic gut dysbiosis and gut issues, chronic toxicity concerns, which leads to mitochondrial issues or energy production issues. And really what we're seeing is this new wave of chronic illness, this new definition of chronic illness that is not treated by some of those like standard conventional care models. And so people are experiencing some of this new definition of chronic illness, yet they're going and seeking care from some of the same model that is not equipped to necessarily help them, right? So we talked about just defining this new wave of chronic illness, especially around getting comfortable speaking about the immune system. That is something that I don't think it's just post-COVID. I think it was absolutely happening pre-COVID. It's just become way more apparent now that a lot of what we're experiencing in terms of hormonal collapse, things that we're calling, hormonal imbalances, things that we're calling, just some pesky gut issues. This is actually some deeper underlying immune dysfunction that is going on, and it's going untreated. It's going dismissed. It's going ignored. It's going gaslit, especially for a lot of women that are going in and kind of getting a little bit more of a run-of-the-mill conversation. Again, just around, you're stressed. Have you tried eating less carbs? Have you tried eating cleaner? Have you tried losing weight? And I am telling you right now that this new wave of chronic illness, that's not it, right? That's not going to touch it. You feel dismissed, you feel ignored, and you probably actually feel worse if you're trying to follow a lot of that conventional medicine advice. So what do we do about it, right? And that's where last week we got an opportunity to really dispel the three most common myths and the three kind of lies that I see keeping people stuck. Number one, that is us associating our weight with our health. We got to stop that. We got to cut that off right here, right now, because a lot of times, like I said, that's what's keeping people sick, is they are thinking that their weight is a reflection of their health, when in reality, it's the opposite. Their health, their weight is going to be a reflection ultimately of this like inside out conversation, right? It's not this, if you lose weight, all of these conditions go away. It's like, no, you're probably feeling uncomfortable in your skin because there's some inside out health concerns. So we have to start treating weight as a symptom, not as a cause, because that is giving a lot of people a lot of disservice in the healthcare field. It's also exacerbating a lot of disordered eating tendencies. And let's be real. So we also discussed the lie around food sensitivities being a root cause solution, when in reality, it is actually more your digestion, not the food. And also just mistreating everybody for this like insulin resistance trend and insulin resistance pattern, right? And so having a lot of those conversations of really building to this place where we're at, understanding how the conventional medicine system is grossly unprepared to kind of handle this new wave of chronic illness that we're seeing. I want to come in today with some actionable and some tangible takeaways. So this is going to be a very education-packed, very takeaway-packed episode for you. If you're someone that likes to take notes, you can take notes. Obviously, all of this will be recorded and uploaded to my YouTube page as well too for future viewing. So without further ado, let's dive right on in, because if you've, like I said, been following this series and you're starting to wrap your mind around this new definition and new wave of chronic illness, maybe you feel like you fall into this category, or you have loved ones that have fallen into this category, and you kind of also maybe feel a little bit like validated by some of the myths that we talked about last week. It's like, oh my gosh, I am stuck. I am stuck in some of those belief patterns, or a lot of my current healthcare providers are still under those belief patterns and are pushing a lot of those belief patterns onto me. Today will feel, like I said, almost a breath of fresh air, because it's going to feel very empowering to understand how do I start to take control of my health and take it a different direction, so that I can feel like I have a really good handle on this new wave of chronic illness and getting ahead of it versus getting swallowed by the wave. That's what I don't want for people. So what we're going to really talk about today is a little bit more of a higher level question of, if we really haven't found relief yet, right? Probably because we're trying to use the conventional medicine model for something it's grossly unprepared for. Even if we feel like we're doing a lot of the right things. I see this all the time within my practice. People who finally get the courage to start to advocate for themselves, to ask for more answers, to seek out some more labs, and they go to their conventional medicine provider only to be handed the same exact, maybe like 5 labs, 5 biomarkers over and over again that always come back normal, the same basic blood work that they run over and over again, the same like, oh, it's just stress, it's just aging, it's just your hormones, it's just being a woman. It's like, but really what we're not giving individuals is some answers to the actual root cause markers. What are those markers? What are those labs that people should have full access to that can validate your symptoms, that can actually reveal where the dysfunction is happening? And more than anything, once we have those answers, it helps actually guide your path forward. Even if, like I said, a lot of these labs were never even tested for you, this is something that you absolutely still have the empowerment around asking and kind of demanding a better quality of care than just the same basic blood work over and over again. So today I want to talk about the labs that you've never had run, the essential labs that I feel like everybody should have in their arsenal and have in their toolbox, not even just for preventative medicine, but also what are those labs that we should be asking for when we're having these symptoms, when we're struggling with chronic immune dysfunction, we're seeking out things like autoimmune disease diagnosis, we have chronic gut issues, we have this hormonal collapse, we know things aren't right, and we're really looking for better answers than just blaming it on our stress, or blaming it on our hormones, or blaming it on age, or worse, blaming it on our weight, or blaming it on our lifestyle. It's like, oh, you just must not be eating clean enough, or maybe you're eating more than you think you're eating. Like, those types of conversations should not exist in a healthcare experience. We should be listening to the patient. We should be believing the patient, number one, and then we should be following it up with not just their subjective lived experience. That is a huge part of the data and analysis, is actually listening and collecting, like, how do you feel in your skin every day? How do you feel in your body every day? Is that something that's expected? Is that something that's normal, not normal? And then also doing our due diligence of following up that subjective lived experience with objective labs. And this is where I feel like a lot of especially our conventional medicine system can do a hell of a lot better, and something that I really make a point to do better for individuals within my functional wellness consults, as well as just within my coaching and my teaching in general. So Why you probably still don't have answers for your problems is maybe a double part solution of, like I said, not feeling like your story is necessarily being heard or your symptoms are being taken seriously, but it's also probably a bit to do with the objective labs that you are or are not receiving. So kind of speaking about the elephant in the exam room, a lot of times you've probably had labs done, right? Most people have had some basic labs. Maybe you've even had labs multiple times, and yet you're still struggling with symptoms. You still feel like you don't have answers. You're still being told that everything looks normal. What most people, and honestly, let's be real, most even providers don't even understand is that there is a massive difference between running labs that screen for disease and running labs that screen for dysfunction. More often than not, like I said, conventional medicine, their labs are specifically designed to take somebody from dying to surviving. Right? That is what our conventional medicine system is so good at. They are very well trained in emergency acute care situations to really diagnose disease. But if you're not dying and you are surviving, they're kind of at a loss there, right? Because they're not equipped to go from surviving to thriving, right? And so they're running the same labs over and over again, whereas I'm over here trying to help take people from surviving to thriving, and I'm running completely different labs because I'm not screening for disease. We're screening for dysfunction. We're looking for why are you not feeling your best? You're of course surviving, you're upright, you're barely making it through the day, but you're exhausted, you feel bloated, you have brain fog, you have headaches, you have skin issues, you have hormonal issues, you're not sleeping through the night, your energy crashes every single day. Like, what conventional labs are built around is a very simple model of find disease, diagnose disease, and then manage the disease. That is their kind of 3-step model. If they're lucky, they might catch something after it has already progressed into full diagnosable disease territory. But for the millions of people that are experiencing chronic symptoms every single day, like chronic immune dysfunction, autoimmune activation, gut inflammation, hormone chaos, or even just metabolic dysfunction, these labs, they're not answering the right questions for us. And so then of course they're not going to give us the right answers in that respect too. And so don't, like I said, really knock on your provider or your practitioner for that. It's more so the system that they're working in, and the training that they have is more around if you're dying, they can help make sure you're surviving. But then beyond that, we need to think and understand we have to look outside of that system, because you're going to get frustrated. You're not going to find the answers that you're looking for. And chances are they're not going to be able to give you any answers until it's long past an intervention point, right? They're going to wait and wait and wait and wait until labs are normal, labs are normal, labs are normal, labs are normal. And then all of a sudden they're not normal, right? When we probably could have intervened years ago when things were showing early signs of dysfunction, and we actually had a much better runway to intervene and change your health trajectory versus just feeling like we're just sitting on our hands, just waiting for something to pop off. I'm not all about that. So most of the markers, like I said, that I really actually want to look at are going to reveal these early stages of dysfunction, ones that can stop illness in its tracks. Honestly, though, a lot of times these are ones that unless you have a diagnosis to justify them, you're not going to get a provider that's working in the conventional medicine system to really run those markers, and nor will they know what to do with those markers because they're just used to diagnosing disease. And so it leaves people on this really maddening cycle, or this loop of your symptoms aren't bad enough yet to meet some sort of diagnostic criteria. And so then therefore your insurance doesn't cover further testing. So let's just wait and see. We'll just wait and see when you get more exhausted, and when you get more symptoms, and you get, more advanced. We'll just wait. And when things get bad enough, then we can run those extra labs. When it's that just is such a wild thought process to me. Why would we not like really cast a broad net? We know that we have access to blood work. We have lots of different blood work markers. And instead of just screening for disease, why are we not looking for dysfunction? And on top of that, we also know that blood work is just one medium that we have, right? And that's like, I think a lot of people kind of get stuck on blood work being the only forms of labs, when in reality, blood work is fine. Blood work is, I always use blood work as a starting tool. It really kind of gives us the breadcrumbs to be able to understand, okay, what direction do we want to go for this particular person? Because blood is really just showing us a snapshot of like what is in your veins at that point in time. It's not necessarily telling us what's happening in the places where your immune system actually lives, which is normally things like your gut, right? Where 80% of the immune system lives, but very rarely do we do any sort of like dysfunctional gut testing, right? So it's just kind of maddening to me of like, where individuals are getting a little bit frustrated and dismissed is because they're not utilizing their resources to understand like, oh, the system that I'm trying to operate in isn't necessarily equipped to give me those answers around dysfunction. So instead of just like constantly trying to do the same thing a million and one times and expecting different results, like that is the definition of insanity, and you feel insane, right? You're like, I feel like I'm going crazy. It's not you. Like I said, it's also even not your provider. It's the ultimate bigger system that they're working within, and it's just their training is going to only take them so far. So we have to be the educated patient to advocate for ourselves and understand, where are we not looking? And instead of trying the same 15 labs over and over again, why don't we get some better success markers here? So what I want to dive into next is like actually putting that into action here. We know that some of the most basic things that we can look at are found in blood work. And to me, there's like 3. I think we could probably name at least 10, but I narrowed it down to 3. What are the 3 most essential blood work markers that I feel like everybody should be getting these blood work markers on a regular basis, if not once a year? At least every 6 months. And if you're actively going through a healing journey, you should probably be getting these numbers checked at least every 3 months, right? So even when working with patients that are part of my coaching and part of my programs, we draw blood work labs every 3 months, right? And I'm constantly changing. I'm constantly customizing these blood work panels. I'm constantly seeing like, ooh, based off of this person and having worked with them for a while, what markers should we be looking at, right? So it's not this like cookie cutter approach. It's truly understanding, what are we working on? What symptoms are still happening? Where are we getting stuck a little bit? And starting to really customize that experience is something that is huge, huge. So to really narrow it down, what are, to me, the most essential blood work markers that you absolutely should be getting? You're probably not getting these blood work markers unless, like I said, you meet enough diagnostic criteria to do it. Or like I said, you're working with a provider that's kind of thinking outside the box, which I love. So bare minimum, most people are thinking like, oh yeah, I got my thyroid checked. Like they ran a TSH panel. I'm like, that is not, no ma'am. Like that is not a thyroid panel. Or like, oh yeah, I've had blood work done, and they'll send me the results and it's like a lipid panel. They ran like total cholesterol, HDL, LDL, triglycerides. Maybe they ran a glucose and some like liver enzymes. And I'm like, cool, right? Unless you're full blown like diabetic ketoacidosis, like this probably isn't going to look too funky here, right? And they're like, they said everything looks normal. I'm like, yeah, that's because they're running labs from a like diagnostic disease lens, when obviously you are not diseased. You are just like barely surviving and not yet thriving. So we need to order labs according to that, because we're not going to get answers running diagnostic labs when we're looking for dysfunction, okay? And like I said, those panels, like by the time they're off, there's probably been underlying dysfunction for a long time now that we probably could have intervened on earlier had we known. Okay, so let's just start with blood work, because obviously blood work, like I said, is something that I start all my patients with as part of our onboarding process. It's something I use very frequently in practice. So when we think about the 3 essential blood markers, what are we looking for, especially if we're thinking about this new wave of immune activation, this new wave of chronic illness coming through? Number 1, high sensitivity C-reactive protein. Okay, this is a inflammatory marker that is found in the blood, very easy to measure, right? We're already in there collecting a sample. High sensitivity C-reactive protein is your body's fire alarm. Okay, it's the best way I like to describe it. It gives us an overall marker of inflammation. Now, this is where our investigative work has to come in, right? Because it tells us that there is inflammation, and it tells us how much inflammation there might be. It doesn't necessarily tell us where the inflammation's coming from, though, right? So that's where we have to do some of that deeper dive and, like I said, deeper analysis to really understand, okay, where is the inflammation coming from? We know it's there. And a lot of times this right here, this marker can be so validating for individuals, because they're like, I knew it. I knew I felt inflamed. My body feels inflamed. And like everybody just kept saying it was, my age or my stress or anything like that. It's like, no. Like there is inflammation, and I'm going to do my due diligence with you to help figure out where it's coming from, right? So high sensitivity C-reactive protein, it is it's like our body's fire alarm. It's a marker of inflammation. Ideally, we want this number as low as possible. A lot of the standard reference ranges on labs will say anything below 1. I personally even like to see it definitely below 1, if not below or closer to 0.5. So this can be a very predictive marker of overall inflammation, autoimmune dysfunction, definitely what's going on in the gut, what's going on with overall hormone regulation and mitochondrial balance as well too. So it can indicate early stage immune dysfunction, right? Instead of just sitting on our hands and waiting for you to meet enough diagnostic criteria to like send you to a rheumatologist and work you up for autoimmune disease, let's nip this in the butt and let's interrupt it before it becomes like full-fledged dysfunction. So early stage immune dysfunction, tissue distress, even gut permeability can be picked up in a high sensitivity C-reactive protein. Even if everything else on the lab looks normal, this matters a lot, because chronic inflammation is going to drive autoimmunity, fatigue, mood changes, metabolic dysfunction, leaky gut. Without this marker, a lot of that stuff can kind of fly under the radar. So definitely looking at things like high sensitivity C-reactive protein, big one, awesome one. Of course, I could throw in some bonus markers there with like an ESR, sedimentation rate. I could throw in a bonus marker like a homocysteine marker, right? There's other markers of inflammation we can look at too, but for sure, high sensitivity C-reactive protein, I run it on all of my functional wellness consult panels. It's something that is a very preventative marker. So that's marker number 1 that you should be getting, probably aren't getting. Marker number 2, thyroid antibodies. We have our TPO antibodies and we have our TG antibodies as well too. So 2 different ones. Most providers will run both of them, or at least run one of them, to start to really get this indicator of a full thyroid panel. It's not just TSH. I honestly laugh at just a TSH and a free T4, right? I want to see TSH, free T4, free T3, your TPO antibodies, ideally even a reverse T3. Like, we're not just testing some basic thyroid panels, because the real story here is the immune system's effect on the thyroid. Okay, how many individuals does their thyroid dysfunction? They're symptomatic for thyroid disease across the board, and their TSH and their free T4 looks normal because nobody ran their thyroid antibodies. Come to find out, their thyroid antibodies are through the roof. No wonder they feel fatigued and their hair is falling out, and they feel like their sleep is a disaster, and they feel like their body composition is a frustrating cycle for them. It's like, we've got to look at the immune system. Okay, we've got to grab these antibodies, because over 90% of hypothyroidism is autoimmune concerns, right? And missing these antibodies really delays some of that opportunity for early intervention for us as well too. So always collecting an hs-CRP, always collecting those thyroid antibodies. And the third one that I chose to highlight, although like I said, I had to narrow it down here, fasting insulin. Fasting insulin is another very easy one to grab, but yet we're here just looking at things like glucose, or maybe in a perfect world, we would also get like a hemoglobin A1C measured on your blood work. But the earliest warning sign of dysfunction is your fasting insulin marker. That is going to change years, up to 5 to 10 years earlier than a full-blown pre-diabetes diagnosis. This is what I'm talking about, guys, is like we're looking at these very primitive markers like your glucose, and it's like, oh, it's not bad enough yet, not bad enough yet. Nobody's measuring your fasting insulin, and someone could be on the fast track to pre-diabetes and type 2 diabetes, and all of a sudden 1 year they're like, oh, I'm pre-diabetic now. I'm like, sir, that was probably building for quite some time. Nobody measured your fasting insulin. We probably could have caught that health trajectory 5 to 10 years ago if we were measuring things more preventative, like a fasting insulin marker, right? So this test is revealing how hard your pancreas is working to keep your blood sugar levels within range. And this was going to rise long before your glucose rises. Chronic insulin is going to lead to inflammation, is going to lead to weight loss resistance, hormone imbalances, immune system dysfunction, even in people that do not meet the criteria for diabetes. Okay, so this is why I love these preventative markers so much. Ideally, your fasting insulin is below 7. Most labs will say anywhere below 20. No, ma'am. Like, we do not want your insulin anywhere near 20. Okay, so don't use the lab reference ranges on this one. Ideally, we want to see that fasting insulin between about 2 and 7, especially if there's any autoimmune concerns or anything like that. So that's, like I said, when it comes to blood, those are at least 3 major markers that most people are not getting tested when they're going into their conventional provider with a lot of these symptoms and concerns around this new wave of chronic illness. And even, like I said, outside of blood work, to me, what is also wild is, like, we know that 80% of the immune system lives in the gut. Why are we only looking at blood work, right? Why are we not doing comprehensive stool analysis? Why are we not, like I said, really looking at things like your beta-glucuronidase, which is your body's detoxification marker? What about things like calprotectin, which is a marker of fecal or gut inflammation? What about your secretory IgA? Like, I don't know, your immune system? Right? These are things that, to me, are way more of a comprehensive analysis and so much more validating for someone than just your basic blood markers that always seem to come back normal or like not bad enough to intervene just yet. So then you get the rigmarole of feeling dismissed, feeling like, oh, I guess I just need to like eat cleaner. I guess I just need to move more. And we really get in this kind of desperate, frantic place to feel better. And because we're not running the right labs, we don't have the right game plan going forward. So a lot of times I see individuals, and by the time they come to me and actually get the right markers, they've already kind of like tried it on their own a little bit, and half of the things that they've been trying have actually made their situation worse. Okay, so that's what I mean by like, let's get a better game plan. Let's get some comprehensive labs so that we have a better game plan. Stop kind of spinning our wheels or wasting our time trying to piecemeal something together and having good intentions, but incidentally making the situation worse. Okay, so if this kind of speaks to you, if you feel like, oh my gosh, I have been getting the runaround with labs, I haven't been getting the comprehensive approach that I've been looking for, head over to the link in my bio. It will take you to my website. Sign up for a functional wellness consult where you can actually experience what it's like to, one, get comprehensive lab work done, and also get comprehensive lab work done before you sit down with a practitioner like myself, and we'll go through the labs together. Not just get a call of like, oh, everything's shipshape, see you next year. Like, let's actually walk through it. Let's talk about areas that are looking really good. Let's look at areas that are giving us some signs of dysfunction. Let's overlay it with your subjective experience of living in your body every day and come up with a game plan. So if that is of interest to you, head over to link in my bio. sign up for a functional wellness consult and we'll get the ball rolling for you. If nothing else, take note of these extra lab markers that maybe you're not getting access to, because these are some essentials that I feel like hold a lot of answers for us.